Hi, I'm Art Bailey. This is the IMT curriculum, Musculoskeletal Alignment. The purpose of this curriculum is to give you a new tool, hopefully to correct people's structure more than you've been doing. What so often happens to us is people come in and say, my neck and shoulders are killing me, my low back is killing me, and could you just work on this area? And yet that's not the cause. And one of the cardinal rules in structural work is don't chase the pain. If you do, you'll never get to the bottom of it. And then we're just totally overwhelmed with structural analysis. So what we're looking for is a recipe that we can apply to the majority of people that walk in the door and get a very good result. The person should get up and feel straighter, their shoulders should feel loose, their back should feel better. It shouldn't matter what their overall pain issue is. One good curriculum can cover the majority of those problems if you know how to apply it. And that's the whole point of this curriculum, to teach you a recipe. A famous body worker once said, get them straight. If they quit hurting, that's their tough luck. That was a very profound statement, and it really got me to looking at structure from that aspect. People are so bent over. They come in, majority of people are humped over, their head's too far forward, their back is bowed, and they're hurting from head to toe for these reasons. They have fallen arches, the legs are too tight. You name it, it all has some correlation. So if they come in with foot pain, knee pain, low back pain, neck and shoulder pain, it doesn't matter. I find that this overall curriculum gets a substantial amount of relief. And that's what it's really about. If you're a body worker and you really care about people, you want to be able to give them some lasting relief. You don't want them coming in every week for the same chronic, miserable problem. So my goal is to get them straight, get them to quit hurting, and then educate them how to continually keep it that way. So what I've done is created a unique system of bolstering and a methodology of working. And I've taken these ideas from everybody that's out there. All the great people that are out there have been just putting out information, and I have a God-given gift of synthesizing information. It's what I do as a teacher. I've instructed martial arts professionally for over 20 years, and I use the same concept. I take principles as opposed to techniques and apply those principles in a systematic way that makes sense. It shouldn't be mind-numbing. What are some of the things that we can use to help us? Well, I have a system of bolstering that's been developed, and that bolstering is unique, and it saves you hours of labor and time. I try to think outside of the box. Some of the other things I do is I use hand tools. Here's a hand tool, just a beautiful hand tool. Michael Daniels makes these. They're hand-carved stones. And this is not one of those spa massage hot rocks. This is an actual tool. And you can put it in water and heat it. You can put it in ice and cool it. And it's spectacular. I can't tell you how wonderful this tool is to use. I have injuries in my hands. I had physical therapy for a year. I was told I wouldn't be able to use my hands more than 50%. I had a reconstructed left hand. But I tell you, I work long hours and I use these tools, and they are a lifesaver. This particular one has just a wonderful design. I think God just inspired Daniel how to do this. Here's another one that he has, and this is more of a, I call it a hand chisel. And they come in different types of rocks. Those are jade. I think this is travertine, and then they also come in stones like marble, jasper. And they're just beautiful pieces of equipment. I can't tell you how much I endorse this. And I'm one of these people, like my mentor, Paul Harvey. He doesn't endorse anything that he doesn't use and doesn't like. And I always appreciated that. And I said the same thing when I got into my own business. I don't endorse anything that I don't use and that I don't like. And so I endorse these, and I admonish you to use these. And we'll be using these in the curriculum, and I'll also show you how to use your hands more effectively. Because of my hand injuries, I have to use my hands more effectively. Otherwise, they're just going to hurt all the time. And you have to work deep, but you have to work effectively. So the key to what I try to offer you is how to work smarter, not harder. I'm trying to give you a recipe that really works, and if you follow this recipe and then add your own twist to it, again, don't get strung out with my techniques. Use the principles and the concepts. Get them straight. If they quit hurting, that's their tough luck. One of the primary things I believe that people have so much pain from is the core energy of the body is just sucked out because of postural distortion. It takes a lot of energy to stay distorted and feel bad in the typical upper cross and lower cross syndrome. Our shoulders are rounded and our back is bowed and kyphosis. We have a lot of lordosis in our back and our hips are displaced, and that you have anterior rotations. And this is just a quagmire, and it takes a lot of energy to keep the body distorted like that. If you take that energy and give it back to the body, your metabolic rate increases, your breathing improves, your cognizance improves. So many things will improve. When your client gets off the table, they'll say, I haven't felt this straight and this well in so long. And they'll recognize immediately a profound change, and that will keep you in business. Guaranteed, people will keep coming for that. They'll tell everybody about it. You won't have to advertise. When you do this kind of work, it's a fact. They'll be beating your doors down because this is what people are looking for. Massage is wonderful. Relaxation is wonderful. But the majority of people have some kind of a pain issue, and it's just chronic and ongoing, and they just feel so defeated because that is the misery of their life. And you take it away and educate them how to keep it. Now here's the key. Educate them how to do it. There's no vested interest in having the same person come in every week for the same chronic problem. If I had a car like that, I'd be suing someone. Have them come in once a month for maintenance. That's as much as they should. After you've taken them through a regimen, they get some straighter, feeling better, then put them on a maintenance plan, and you'll have more business than you'll know what to do with. So again, don't get caught up in my techniques. Concepts and principles are the most important thing. Take this concept and understand it's like taking a car apart or anything mechanical. There's a sequence to the movements. Understand the sequence and how they interrelate. Do the sequence, follow the concept, and use my techniques if you prefer. If you have better ones, use them. And if you have even better ones, send me information. I'll be most happy to use it. I tell anybody, show me something better, I'll steal it. I'll give you credit for it. Actually, we don't steal anything. We liberate it. I have a military background. Military, you liberate things. Makes it sound like it wants to go with you. Anyway, let's get started with this regimen. And I think you'll find that it's wonderful. It's easy to understand for the novice and for the advanced practitioner. And understand that you are a body worker and you have an intuitive sense about what to do. Because you love the work, or you wouldn't be doing it. We all have this God-given gift. That's why we're called to use those gifts. And those of us that really love this work and do it, we know that is a God-given gift. And just as I have mine, I want to share it with you. So, let's get started. We're going to have some fun. Okay, in this section of the structural alignment, musculoskeletal alignment, we're going to also include the self-help portion that a person can do for themselves. So, in order to do that, we want you to understand a few things. In the self-help portion, it's for people that have low back pain, their hips have rotated, they have neck and shoulder pain. So part of the regimen that we're doing overall will also be part of the self-help regimen. The first thing you want to do for someone is to set the pubic symphysis. And what happens is the two halves of the hips are called innominates, and the hip misaligns. You can see that through the bone here called the ASIS, anterior superior iliac spine. And that misalignment causes a lot of pressure in the low back, and often people say, I have a pain all the way around my hip and into my groin. And that's a very common problem. Wayne experienced this recently, and we did this for him, and it gave him a substantial amount of relief. Now you can do this for yourself, and first way to do it for yourself is bring your legs up, put your heels together, and I'm going to use one of these bolsters. This is that unique bolster we're going to cover in this series. Place it here, and he's going to keep his heels together and rapidly squeeze hard together and release. And again, and release. And often you'll get a click that occurs when you do that. Now if you have someone that's here that can do that for you, then you simply ask them to close your legs real hard, and you open them, and close hard and open them. A lot of times this will immediately take out a lot of low back dysfunction. So let's say that particular pain has subsided, but we still have a certain amount of pain. And often that is the psoas muscle complex. The psoas muscle attaches up here T12 in your spine, comes all the way down, blends into the hip into a muscle called iliacus, and attaches to the inside of femur at what's called the lesser trochanter. You can easily test the psoas to see if it's being involved by coming up here and finding the crest, that is the bone, and pressing in and toward the center of the body. You can test it for yourself. If it's real sore on this side, if it's sore on this side, very often that psoas muscle is responsible for that certain amount of soreness, meaning that the hip is rotated and the muscle's too tight. So a fast, easy way to release this is, first of all, I've already laid him on a heating pad. I'm going to ask you to sit up for me. It's important that you don't lay on heat for a long period of time. These particular pads are microwavable, and they use silicone instead of some bird seed, something that the animals will eat. And so they draw moisture out of the air. You can take anything like this or a hot towel that is wet, and you microwave it to get heat, and you lie on it. So you don't lie on heat for an extended period of time. And then I'm back to using these stones again. And you can use the stones, or you can use any particular thing that you can heat up. You can take 2 little water bottles and put hot water in them. And normally you lay these, finding the crest in this vicinity, just like this. And I'll normally just lay it inside the pants. But see, they just kind of fit right around the bone. Okay. Then you would elevate both legs using a bolster similar to this or anything that you can find. Again, there's a kit that we're marketing that has all these components in it. It doesn't have the stones, but it does have the hot pad and this bolster, the little memory foam pillow for your head, and this particular bolster that we just used to release the symphysis. Cross the leg, open the knees, bend the legs back towards you, and this is the release position for what's called iliacus and psoas. Often they'll say it's tighter on one side than the other. If it is, simply rock the legs until you come to a position of ease to where you feel no pain, and stay in that position. And what you're doing is turning off that muscle neurologically. And you take away its stimulus, because it wants to bend and you're bending it mechanically. The body puts sending electricity to the muscle, and therefore it basically turns off. While you're in this position, then come back to what's called a costal margin. That's where the ribs attach right here, and drag this tissue together and lengthen this tissue by bringing it together like you're trying to create a furrow. And this is the opposite muscle that affects the psoas. So as it's tight in the front here, it has you bent, and the psoas muscle is tighter in your back. So if you lengthen the front, the psoas muscle being in your back, like my arms are representing, winds up releasing. So you can get in this position and substantially relieve a low back pain. That's a very common pain to have in your back. Okay? And you'll stay in this position, well, for the duration, normally about 10 minutes, something like that. Now we'll take this out, and we'll start the overall structural regimen. So we'll say we've already done that. As far as release, this person's low back. And I'm going to pick up a little ointment, bring it over here to where I can use it. Put it right there for me. Put a little bit of ointment on the bottom of the foot. Sometimes the feet are extremely dry and cracked, and this certainly helps when you're going to do this work. And we're going to do some rocking. I place the foot into my abdominal cavity, which feels fine to me. Some people say, I don't know how you do this, but it really isn't that hard on you. My body is doing the rocking. I'm holding this foot right next to me. I'm reaching in here to the heel cord, placing tension, trying to go up underneath the heel cord. Often you'll find trigger points in that area. And placing the foot at one angle like this is pulling to part of the gastroc. And then switching. Again, constantly keeping it in close to you. And this pulls into the other part of the gastroc. At the same time, I'm loosening this retinaculum band in the front, noticing that my hand is reaching and pulling into the instep. So really I'm trying to just loosen up the foot. You'll feel all the bones loosen up as you do this work. It's a very nice piece of work for plantar fasciitis. And it definitely loosens up the lower leg. So we'll start from there, and then from there we'll go on into a piece of bolstering for the leg. I like using bolsters. It certainly makes my work easier. The next thing I want to do then is reach here and work this anterior section. A lot of times people tell me that they have a lot of pain in the bottom of the foot. And you can test that, of course. You can take one of these stones and you can warm up this area. And you can strip through it. And use your knuckles, using the stones as a real good hand support. And lay into it again. Brace your arm into your body. If it's too sore to do that, and sometimes it is, you'll find if you release this anterior tibialis, where people so often get what's called shin splints, that is going to be a lot of the pain that they're dealing with. Again, nice and easy, starting way down at the instep and coming up. And I'll ask him to bring his foot up and down for me. That is just the foot like this one. Nice and slow. There you go. And down. And up. A little bit faster for me. And down. There you go. And as he does this, I'll just work right up. And of course, come off of it at 90 degrees. That's good. And again, you can use one of these stones just like this. Soften this tissue using my thumb, using my knuckles, and using a piece of this stone at the same time. And that is working the anterior lower leg. A very common problem that people have is hyperpronation, and it causes so often that fallen arch. And you can see, if you look, where the muscles are too tight. If this is too tight to this peroneal, then it's going to pull the foot in this position. If you look at the bottom of the foot itself, you can see if it's cupped too much on one side or the other. And work the areas that is pulling toward, and try to release the tissue that seems to be pulling and deforming the foot. All you got to do is see where something is being pulled too much and release the area that is being pulled. Another thing to release the pain in the bottom of the foot is simply reach around at the malleolus on both sides. Now don't dig in here, it's very painful. Add a little bit of pressure and slowly sink in and around the bands and move the foot. The proprioceptive signaling here will help lengthen some of this muscle tissue because of the Golgi's tendon organs located at the ends of the muscles. So you can do this, and again, then go back and test. And you'll know where the soreness is coming from, where the tension is coming from. And that's how you can address that issue. Okay, we want to go then from the lower leg up into the upper leg. And we'll roll this right up here. And same thing, pick up quadriceps. Always try to pick up the muscles, scoop underneath and pick the muscles up. Try to create as much space as you can between the sleeves of the muscles. And again, you can do this. This is where I often use 2 stones. Because I find it's handier. Again, you'll have to figure out what tips of the stones to use. Here, as you can see, my thumbs are working. They're supported by the stone, and I can pick it up a little bit more. At the same time, remember, these are warm and they're wet, and the tissue will be relaxing faster to that stimulus. Okay? From there, you want to work across to the abductors. Simply bring the leg across. Normally I take this out of the way. Bend the bottom of the leg. That keeps him from rolling so much. I straighten it. Working around the instep. Really work that retinaculum and under the base of the foot. Remember that the tibialis posterior and the peroneal longus form a strap that comes up underneath the foot and basically helps create the arch. So it's important to get those muscles to release their tension in order to get the foot to get good alignment. Okay? Then simply cradle it in your arm. Reach up here above the malleolus, basically capturing at the instep, and with the broad band of your arm, and let your body fall into it. Don't just sit here and push with your arm. Let your body weight fall into it. And you get up around the bony areas, like the fibula there. Ease up a little bit. Cross back into it. And you're on that vastus lateralis here. Come all the way up until you feel the trochanter and kind of loop around it. You can go up underneath that vastus lateralis between it and the hamstring with your elbow. Same thing. Come back to the rectus femoris right here, using your elbow, and just loosen all the tissue. Again, allow it to bend. Work it at a 90-degree angle to the muscle, and you'll find fascia loosens faster if you work 90 degrees to the muscle. Okay, this is not rocket science, and I'm sure you've got 100 other ways of doing the same thing, but understand you have to get this entire lateral line to loosen up. And from here, continue to bring the leg, and you can do this any number of ways. This leg's going to be straight. And wait, I'm going to slide this out from underneath you. So if you're working into these areas that feel a little uncomfortable to people, simply place one of these nice, heavy, hot pads in that area, and you'll find that gives you a real nice barrier, and you won't accidentally slip and cause them discomfort. And they'll be appreciative of that. Okay? Again, keep the legs straight. Working that retinaculum again in the front, across the bottom of the feet, and then slowly start moving on the medial aspect of the leg. And be working the adductors, the adductors. I usually place this into my body, and that's where I'll get my pressure from. Okay. What you can do then is leave it at this point and fall into your shoulder and simply slide up between the hamstrings, staying off the engagement area. And raise the leg just like this and move up and down. And slowly go between the hamstrings using the point of your elbow. And follow it all the way down to the ischial tuberosity. And again, same on this side. Here's the medial hamstrings. So you can either pump the leg up and down or just leave it on your shoulder, just like this. Now if you have a really big person that's hard for you to work on, it is possible to get this angle. Simply stand back and back into it using your back. Okay? Doesn't matter how you get there. Understand what you're trying to do. A really important area to work is around this ASIS. So you want to reach around it and hold it. And really work the muscle holding on to the ASIS. Drag your thumb under it, reach around it, because you have so many muscle attachments at this area. And just cross fiber. We'll be doing a lot of IT band work at this point. And that's a good loosening up of that area. Again, we're not going to do both sides constantly because we're trying to cut some of the time on this work. And if you can do one side, you can do the other side. Next thing we want to move into then is a little more bowstring. And we're back to this costal margin. We talked about the costal margin and how important it is to know that this area so often helps pull this entire front line. So releasing it, of course, is going to make it that much better. And I have a tendency of wanting to warm it up. Okay, so I place the stone into this edge, and at the same time move this tissue from lateral to medial. The same thing here. I can just kind of press it up underneath the ribs. You okay here, Wayne? Okay. I'll always check with him, make sure he's doing okay. So you can do this any number of ways. Take my fingers here and then slide up underneath the ribs. Again, the stone is acting to warm the area and it's giving me hand support. Can you do it without it? Sure. It just happens to work a little bit better having something like that nice warm stone working for you. Your clients will tell you in a minute that they prefer having that heat as you're working the tissue. Again, work everything toward the center. Now, the rectus abdominis, of course, goes from here all the way down to the pubic bone. I don't generally work below the navel, not much reason for it, because it gets enough effect right where it is. If you need to go down and work in that area, then you'll have to explain to the person how you're working and they'll be comfortable with it. And there are circumstances that you might want to, but overall this does what you want it to do. So you go from here. The next thing again is working into that psoas. And going across the crest here, pressing down toward the center. And then I capture the entire ASIS usually in my hand. And I find one more muscle. I find the pectineus. I cross the leg and I ask him to raise his knee up. When he does, I go down to the adductor longus and back off a little bit. You'll find the pectineus comes up underneath your fingers. So once you locate that spot, keep a finger on it. Take the rest of your fingers and lead them around the ASIS. Okay. We'll take this bolster out now because I've worked the costal margin for one reason, with a bolster to keep that area folded and soft so it wasn't as tight and hard to work on. Now I don't need it. So I can reach again back to the pectineus, knowing where it is, reach around the ASIS and start moving the leg. As I move the leg in different directions and I keep pressure down, I'll feel the psoas come up underneath my fingers. And what I want to do is clamp it. And as I pull, it will be basically lengthening. So I'm actually giving length to the psoas without causing it to lengthen all the way up to its attachment at T12. And this is a real nice way to release a lot of the problems in the low back. So this range of motion, understand what you're doing here. In order to release the hip from its anterior rotation, you have to be able to release the psoas, the QL, the pectineus, the quadriceps, the IT band. That's usually what's got everything rolled forward. It's important to know that. And all the way down this lateral line, if you don't get this proteus longus to release, then you're not going to get rid of that hyperpronation. Hyperpronation from this proteus longus is sometimes attributed to a chronic SI dysfunction. So you can see why it's important to do this. But you want to do it sequentially. Loosen the plantar fascia. This plantar fascia goes all the way up the back and ends up right around here at the frontalis, all the way up the back, following the bladder meridian. You want to loosen this instep, this retinaculum. This retinaculum acts like a mechanical wheel under which a certain amount of bands run, being these tendons. And it can bind the motion of the foot. So it's important to loosen that up. Very important to loosen up the anterior tibialis. Now this can be very uncomfortable. It's more comfortable often peeling away from the bone at 90 degrees than it is stripping along the bone. And you'll get a much better effect for that. More knee pain is caused from the muscles above and below the knee than anything else. One of the most common spots is the pes anseris, called goosefoot, where you have three muscles that join on the medial aspect here. And that's the gracilis, the sartorius being the longest muscle in the body, and the semitendinosus, part of the hamstring. So it's very important to keep that area loose. Okay? And that pretty much covers the beginning part of this in the supine, number one part of this structural alignment. This will be the sideline position, and it's going to be an optional position, but it is an important position to consider in this structural regimen. And you'll be working everything from the occiput all the way down through the laminar groove into the hip flexors. And one of the more important things I've found is this anterior rotation of the hip, which is the more common problem in the hip, in that it's anteriorly rotated. You can get posterior rotation, but the majority is going to be anterior. So for posterior, just kind of reverse some of the ideas. First thing we want to do then is understand one of the important muscles that seems to fight us is this quadricep and IT band. So we'll bring this up to the ASIS right here. And it's very important to understand that this can be very uncomfortable, so you have to communicate with the person that you're working on at all times. Again, I'm back to using this heat to loosen up the tissue. What I want to do is really lengthen this area. The IT band and this quadricep, especially the vastus lateralis, seems to be a real problem. The easy way to do this is to bring the foot into your body. The way that's important that you let me know if anything's too uncomfortable. I'm expecting a pull right here. I don't want it to pull into the knee. So if it pulls into the knee too much, it's important that you let me know. I'm going to reach in here on the medial side of the knee and hold the attachments of that pes anseris. At the same time, I'm going to pump the leg with my body and start cross fiber. And I'm going to come right in here just below the ASIS and cross fiber. Just like this. And I can take my hand and lever using the leg as a holding point. And then I pull back, same thing. The object, of course, is to get to where you can bring the heel as far back as possible. You can use two arms now, and you can take the tissue right about the ASIS here, or at the trochanter, and you want to take it back, up and back, just like this. And this tissue you want to lengthen in the front, so you can do two things. You can do two movements at one time, and just synchronize your body with it. There you go. Once you get this synchronized, it's not a bad movement at all. Move the gluteals up. Always move the gluteals up and try to get the pressure off of those internal and external rotators. How are we doing there, Wayne? Right. Okay, and that's a really good movement. You can take that movement then and assume that you lengthen this and put a little bolster underneath the knee, and again follow that entire lateral line. These little memory foam bolsters are spectacular also. Give a little warmth to this tissue. You can hang this off your table and work with it down if you have an adjustable table. Not everyone does. And I normally reach right up here and capture the tissue at the ASIS and hold it, and then start with a broad band movement. And again, be cognizant of your endangerment areas. Get past the knee, ask Kim to start, move your foot up and down for me slowly. There you go, up and down, and up toward me, and down, and up toward me, and down. And do that all the way down. Okay, and you'll make that same stroke as many times as is necessary. You can go a little bit behind the vastus lateralis here, separating it from the hamstring. And same thing, you can go into part of the gastroc here and into the soleus. Up and down, up and down, up and down. There you go. And that peroneal. So that's a real good way to do that. Okay. And then we're going to go above the trochanter here and work the crest and continue on up the back. Okay, now we want to go up the back side. We want to work off the crest, up the back, work the laminar groove, and up into the occipitals. Okay, work this lateral line, and the more you lengthen this side, the more the overall body is going to lengthen and relax. Okay, so we've done the lower leg, and it's bolstered still. And again, keep the bottom knee up. As it stays up, this person stays more stable. I'm going to warm the tissue again. Warm it up the back. And again, tissue likes being warmed with wet, hot water. Okay. Put some ointment on. Now, I want to focus on moving the tissue off the crest from lateral to medial, because I have anterior hip rotation. So if I had posterior hip rotation, I would move in the opposite direction. And that's just working up and off the crest. Next thing I'd like to do then is the QL. For lordosis, you always work medial to lateral. Kyphosis, you always work lateral to medial. So we'll say we have some lordosis here. Finding the QL following the 12th rib, I'll do two motions at once. And this is where I'll support my hand again, because I like hand support. There we go. And I can work this all the way over into that costal margin. Okay, and I'd like to get a little more length out of the body. So I'll bring the arm up, and I can drop this leg off now. And I'll tell him if at any time it's too uncomfortable, you just pick it up. But I'm going to lock my body next to his, so I have his hip locked, and with nice easy movements, just go straight up the erectors, through the shoulders, and lengthen this latissimus. Remember that latissimus is an important muscle that pulls your shoulders forward, so here's a good way to lengthen it, using this tension that our leg is applying for us back here as it's off the table, and it gives us the same effect as a good side bend. Get a lot of lengthening in here. Again, I'm working much faster than normally you would be working, but then this is demonstration more than anything else. I will then take both knees and bend them up toward him, place a pillow between them, because if you do that, he keeps from rolling as much. Okay? And I'll get another stone. And this is where I pick up one of these small hand chisels again. If I take his arm and fold it back to me and just cradle it just like this and let it fall, now I've got a pretty good control of this shoulder. And with a broadband strip, I'm going to start pulling the entire shoulder back. Just lean my body into it, go under the suboccipitals. And again, we're working that motor cylinder that we talked about, pulling it back. A lot of the work is redundant, and it's okay that it's redundant because you can't do too much of it usually. So again, I'm moving that motor cylinder back, and again, I can use this stone if I want to work deeper to those suboccipitals. But this is a great way of pulling that levator. Instead of trying to pull the head off the body, try to move the body and just pin the head. You can also go from here and work into the fascia in the scalp. Simply holding into it and dropping your body back into the shoulder. You can then reach around and distract the scapula. And very often you can get a real good distraction. And just rock the shoulder around. Don't try to rip his arm off. And you'll feel all the way when you get up to the tip of the scapula, which is one of the hardest places to work. You can reach it in underneath the trapezius and again find the tip of that scapula and clear those attachments. Very nice, easy work. His arm is very relaxed. Then what you can do is you can take this infraspinatus and you can start dragging it from lateral to medial. And start moving this shoulder back. In the front, I'm holding onto the shoulder, and this is very similar to some of that shoulder distraction that we did earlier on bench work. You're bringing everything back. Everything back. Okay? And once you've done that, then here's a really unique way of working the laminar groove. Working laminar groove in the prone position is what most people do. I find it's a little more comfortable if you don't try to dig it out like dirt. So if you'll reach in, starting at around the iliolumbar ligament, and that's easy to find, follow the crest around, draw a straight line across the top of it, and you'll be at L4, come down one notch, you're at L5, and slightly over, and you'll feel the depression, and that's your iliolumbar ligament. Now hold next to the spinous process, take your arm and pull the tissue away. Compress it in to give you depth and then pull it away. Compress it in and then pull it away. So push in, go deep and pull away. In, deep and pull away. And you'll physically pull the tissue out of the laminar groove as opposed to just digging it out and pinning it and distracting it. You'll be surprised how strong your fingers can be when you use a triangulated finger motion. It's a little bit harder up here around the shoulder to do that. It just takes a little time to learn. Often I can reach up here and hold it again like I did for this very top part and get the same distraction. Following all the way up to the base of the occiput. And again, I use that triangular, almost looks like one of those Star Trek things when you use your fingers like this. It actually comes from martial arts. It's a hand position that allows you to make very strong fingers. Okay? You can use your thumb. You can use one of these hand chisels, as I call them. It's a wonderful tool. Again, always use your finger in conjunction with it so that you can feel where you are. Usually I have my knuckle around one side of the spinous process and this on the other side. And that lets me know exactly where I am in relationship to the spine. that I studied at one time was able to manually move all of the vertebrae using this pincer type grip. It's not something that we do, but I did find in studying that I could clean out the lamina groove more effectively from that concept. And that got me into looking at pull the tissue away. Again, a lot of ways of doing it. You can lock your arm into your body and just rock. And the rocking effect has a good effect of pulling that tissue out. Okay, there's no real wrong way of doing this. And you can go all the way across, as I said, the costal margin. Now, in clinic, I usually use hospital gowns and shorts for ladies. And with a hospital gown, you can easily move to this position. And you can always take one of these hot pads because it has weight to it and they feel comfortable. And you can place it in this position. You can ask them to take their bottom hand and simply hold it right there for you. That will keep them extremely modest, and you'll still be able to do a good amount of work right in here, all the way into this area. So you won't have any problem with coverage as long as you use these safe draping methods. Okay? And the last thing you want to do then is a range of motion for this leg. If you keep pressure down into the trochanter, just relax your leg. Notice I lay on my hand and I put the palm of my hand around the socket and simply move back and forth. And this is a way of using the head of the femur to clean out some of the crepitus and restrictions in the socket. It's a very nice movement. So you can just lay on your hand and use your hand as a cup and feel where you need to hold. When you feel restrictions, hold those areas. Also allow you to work more around that ASIS, which has all those connected points that are very important to clear up in order to decrease the anterior hip rotation. And that pretty much covers the lateral work. And again, this takes a little while. Do it slow, take your time, but I think you'll find it to be very effective. Okay, so this will be the prone position in the structural regimen. And what we're trying to cover again is to lengthen the entire back line. We're going to go through the plantar fascia, through the back of the calves, which include the gastroc, the soleus, the underlying muscles. We want to lengthen the hamstrings and do something called hamstring rocking, which is try to separate some of the adhesion that occurs in hamstrings right here at the back of the leg all the way up to the ischial tuberosity. Then we want to go through the upper back, starting to release again into the laminar groove, the QL, back up to the latissimus, and get a nice overall torque in the body. After that, we will place the body into a suspended position to rotate the physical hip back in place, which is the second part of the self-help curriculum. So starting with that, I'm going to come over here and engage the plantar fascia. Now I'm using a bolster, of course, and back to my appointment. And if I place the foot firmly into my hand and then place my elbow down into the bottom of the foot and just add compression, often the metatarsals will spread when I do that. And I can also again assess the foot by looking at it and seeing, is it more cupped on one side than the other. If it is, then concentrate on basically molding those areas until I see a change in tissue in whatever direction that I need to mold. I want to get a nice triangulated foot here so that it doesn't have a big cupped area on either side. And all I have to do is look at the tissue for that. Supposedly I've worked on the hyperpronation already up the leg to the pronotum. Then we want to work into our famous calf area, as people call the gastrocs. And you can take your fingers and just reach up underneath and pick it up. And you want to really pick it up. Now what's wonderful about the stones is, come back to the stone again. I've already gotten 2 warm stones here. And any number of ways to do this, using the edge of my hand to pick up the tissue. And I may choose to use 2 stones, and this is a very comfortable thing. Picking up the edge, again, you can see it lift right up here, just physically lifts it right up. So you want to go deep up underneath there, trying to reach those underlying tissues. The soleus is really the powerhouse of the back of the leg. The gastroc is not as powerful. It gets all the fame, but doesn't do all the work. So to really get some relief in the back of the leg, you got to get down into that soleus. Soleus is a Greek word for fish. Again, stay off of the endangerment sites. Next thing to consider is how the hamstrings and the gastrocs do a handshake here across the back of the knee. And often you'll get these adhesion problems where the gastrocs come across and where the hamstrings come across. And a good way to clear those, staying out of the endangerment area here, is to reach in and capture the edges of the hamstrings and press them out. And just weave right up in here, following the line toward the ischiotuberosity. And we'll do that. And then another really good way that I enjoy doing this is I place my body into this position very often. Again, I'm picking up tissue, and I may choose to use these, or those little hand wedges are real handy here also. And I can lock these down, and I can rock back and forth. And as I rock on this side, I'll tension the medial side. If I rock this way, I'll tension the lateral side. And I'll simply walk up and down, tensioning those hamstrings using my body to create the tension. Okay, let's show a little bit better here. And you just have to learn to get in the groove here as each one tensions under your thumbs. And if your thumbs don't work as well, use your fingers. But the key is follow that slip all the way up. Feel the tension and hold it against the tension as you move back and forth. And I'm big into using my body. And go all the way up until you reach the ischiotuberosity, which would be right there, and simply friction up underneath it. And same thing, you can hold this position and you can bring the entire leg back and forth, frictioning back and forth. It's kind of a twisting pull to this entire structure. But separating these hamstrings is a very important thing. And again, go down below the attachment. Go down below the muscle to the attachment, rather, right here. Be aware of where your nerves are. It's really important that you're aware that this coronal nerve right here is fossa. That means just under the surface on top of the fibula. So beware of where these nerves come to the surface and where the endangerment areas are, where the blood vessels travel. These things are what you should know before you're working on people. If you don't have that kind of anatomy background, I would suggest that you do, because you can injure someone if you're not paying attention to what you're doing. And there's no good reason for that to happen. Now what I can do to make him more comfortable is I'm going to give him a chair to put his arms in. See if that's going to be okay. Something like that. You get these expensive tables, they don't give you an armrest. Okay, so we've done this area now. We'll pretty much loosen this up. Again, I'm going at a fairly fast rate, and you're going to be going a lot slower. Put this down to the top of the crest, and at this point, do some nice loosening exercise here. And here's what I call a body sweep. Remember that for lordosis, you want to go medial to lateral. And for kyphosis, you want to take the tissue lateral to medial. You can do both of them at the same time and placing my elbow right close to the spine, into the QL and above the crest, and the other arm down here at the lower ribs, and just sweeping up and down at the same time. Really nice motion. And you can use your arms to push each other. One is pushing, one is pulling. So you can get this motion and get a composite motion going here, all at the same time. And that's really a nice loosening effect. This allows you to reach way down here and pick up these serratus again. Remember how we were working these serratus? You can drive your elbow this far down on the person and just pick up the serratus. So on this side, you can't see it as easily, but I'll reach way down and pick up the serratus. Okay? And again, moving everything inward, lengthening this entire back plane. What you can do after that then is what I call a body torque. And you can bring one leg across, let it fall, and just rock. There we go, just rock. And just lengthen this entire upper quadrant. You can bring both legs together. If they have real bony knees, you might want to put a pillow between their legs and let it fall even further. And you can rock. Now in some positions I'll just drop my leg across here and hold into that costal margin and rock this entire area. And this just loosens up all that stuck rib and that twisted body area. I'll usually reach in here and hold the ASIS and really work the top of the crest of this hip, trying to loosen up this area. Again, your anatomy background will tell you exactly the areas that you're specifically working. I try not to think of muscle as much as I do fascia. Someone once said there's only one muscle in the body, it's just extruded all over the place. And there's a concept to that when you consider that fascia innervates everything that ties together. Okay? And this is another good place, again, to work those suboccipitals. You would ask him, push the back of your head against my hand and tuck your chin slightly. There you go. And that extension right there allows you to really reach in under that semispinalis and release. And that just gives you another way of doing the same thing. Now, in order to distract the scapula, we can place this arm, as we said, not in this position so often as into this palm down position. And with that, you'll find it's much easier to raise the scapula. And again, always move the part over your hand. Instead of moving your arm through the body, move the body around your hand. So instead of digging through here, make the body move around your fingers. And that's a much better way of doing that. Okay? The next thing I'm going to do is introduce this new system of hip alignment. And what it is this concept, and it's an old osteopathic concept. If you take and place the ASIS on a wedge, and usually they would place it on the anterior ASIS and the opposite trochanter, and by lying your body on it, it would allow it to float the hip back into place. What we've done here is take that combination of that and another concept of elevating the legs, so we don't have to go to the opposite ASIS and trochanter, but we can go to both ASIS points. And what it will do is, it will hit this device, which is a board with a wedge, and it will cause it to realign the hip, bring it back into a level, because the body is made out of water primarily, and fascia and tissue is going to find its own level, and the bones are going to just totally realign. We've taken this concept and we placed it inside a bolster. So what would happen is this person's going to lie on this bolster, same thing, so it doesn't drive a hole through the bones, and he's going to lie there, and we're going to do a little bit of manipulation, and the tissue is going to release, and it's going to realign the hip, and you'll get a dramatic diminishment of pain in low back just lying on this. Now this does several things. It also still points the body, shuts down the cranial pulse because you've locked down the two ASIS points, and that in turn resets the cranial pulse and creates a still point, which is a neurologic reset and relaxation. So you can lay in this position just by itself and get quite a relaxation of overall stress. So Wayne, what I'm going to do is I'm going to take this bolster out from underneath your feet, and I'm going to lay this underneath your hip. If you'll put your face back down, and we'll find the right spot to put that. What they can do is usually reach up underneath and capture and place this exactly where they want it. So in a self-help mode, you would lie yourself face down, and of course you probably won't have a face rest at home, but you'll have two of these pillows that come in a kit. You put one under your chest and roll the other under your forehead, and that creates the air gap that you're looking for. So you can do that, lie yourself on this, and you should feel those ASIS bones, which I feel right here. And they're in the center, there's his. And you reach up underneath here and push up, you'll be able to feel that for yourself. The next thing you have to do is get your feet elevated. And what will happen now is you're going to be floating just like that. As you can see, the entire hip floats. You comfortable there?
Yes.
Okay. Do I need to move this? Is that okay?
That's fine.
Okay. So what you want is this floating effect. So for your home usage, it's very important for the person to understand. You lie face down, you have to keep your head straight because you want your spine to be straight. So you put a pillow under your chest, under your forehead, and you have your spine lined straight. You make sure this is under the ASIS. If for some reason someone says, I think my leg's going down, it's quite obvious it's in the wrong place. You're probably shutting off the femoral artery, which is just a little bit below that area. And you don't want that to occur. And you should get this nice floating effect. About every 5 minutes, the person should raise their leg and internally and externally rotate their leg, just like this. So you tell them, lay in this position, you're going to be there about 15 minutes, and every 5 minutes you raise your leg and you bring it across, inside and outside, just like that. You do that to both legs. And what that will do is, as the tissue is softening and the bony structure is trying to realign itself, sometimes it gets stuck in some of that hard fascia, and this allows it to move. This allows it to kind of get past those stuck points. Okay? So this is the body float system. So far, it works like this. For pain, self-help, you put yourself on your back and you bolster your legs and you release your psoas muscle, and that's the one that's got you bound up, allowing you to bend over and raise your legs. Part 2, you lay face down, you put a pillow under your chest and under your forehead. You make sure that this is on those two bones, those bony bones right there. Normally people can feel them right here. Part 3 is your legs are elevated, and you stay in this position for about 15 minutes, and every 5 minutes you raise your leg and cross it over, back and forth, so that the hip can rotate itself back in place. So what you're doing is you're releasing the muscle that has your low back bound, and then you're making the bones basically rotate back in place by allowing all the musculature to float. And this is what this concept is about. So from here, as a therapist, we'll continue to work. One of the things that you want to do is work the ligaments. Okay? All ligaments in theory have a common communication system. Loosen one and they all have some type of reference to each other. I'm not sure how all that reflexive stuff works. I just do the work. But I'll start here at the iliolumbar ligament, and I find it, of course, following the crest, straight across is L4, down is L5, and over a little bit is that area that's depressed. Sometimes you'll find dimples in these areas, and that's usually fascia that's highly constricted, and that's the area that you really want to work. Okay, so you find the lumbar ligament, and you work into it. I usually take and manipulate the leg a little bit, allowing it to flex underneath my fingers. Again, this is where you can use a tool. If you want to use one of these stones, you can reach in here with the tip of this stone, cause a little bit of compression. You can go with the sharper edge and reach deeper down into it, but understand you got to know where this is. Neuromuscular uses this particular tool that they reach in to compress into this ligament. And this does a similar thing. I always use my fingers though. That tells me how deep I'll be going, and I can control how deep I use it. Okay, go to the iliolumbar ligament and come down and find the edge of the sacrum. Place your fingers firmly down into it and try to work underneath it. Just press your fingers down and under the sacrum, working that SI joint. Follow it all the way down until you get to what is the sacrotuberous ligament. The sacrotuberous ligament then will be connecting from there to the issue tuberosity, and you can feel that ligament. One nice thing to do with it is slide under it, hooking towards you, and bring the buttock over your finger, and often you'll be able to affect some of what's called the obturator internus, which is a muscle that affects your pelvic floor. Then come down to the issue tuberosity, work your fingers all the way around it, just kind of cleaning all of the attachments around it. And this is where I'll use, again, I simply grab it with my fingers, something like a little cupped set of fingers, and hook around it, and I'll rock the leg. From there, I'll slide over just a little bit, and I'll feel the indentation, and that's going to be the quadratus femoris. I'll go up from there, and I'll feel until the trochanter falls into my hand, like holding a ball in my hand. And I'll just rotate this entire leg around, working all the connections in and around the head of this femur. Okay, and that brings me back up into the glutes, and then I'll reach here and I'll push up the glutes until I get into that crest. And this is slow work, but it's a very effective work. So you want to work all the ligamental structures and the associated muscles, primarily focusing on the iliolumbar, go through the SI joint, down to the sacrotuberous ligament, across to the quadratus femoris, around the head of the femur, and then back up. And that will give you a real good way of working this. Next thing then is we want to work up the spine. Again, we're still working this laminar groove. One of the mantras of some structural workers is smooth groove, and that makes a lot of sense. You clean out this laminar groove and so many problems diminish. One nice way of doing it is this chiseling. Again, using the tip of my fingers, finding the edge of the bone at the spine and staying slightly out of it, and just chiseling right into the laminar groove. Using my fingers on the edge, and then the leading edge becomes, once I get comfortable with it, I let the tool become real comfortable. You can't see the tool, it's like this. My fingers are right in front of it. Okay, and so you can change your angle, and again clean out that laminar groove. And pull the tissue away so that you don't bunch it up. And the same on the other side. You can do this any number of ways. I simply control the tip with my fingers because I keep track of the spinous process the whole time. These fingers are on the spinous process. The center finger reaches out and touches the tool and allows it to push down. There's no wrong way of doing this. There's any number of ways of doing this. Okay? Another thing that you can do is a certain amount of skin rolling. You can capture the tissue and pull it, leaving one stone stationary, and pull the tissue and bunch it up against the stationary stone. And that will loosen up some of the fascia in and around the spine. I can also take these stones, which have a unique V in them, and take one edge that grips better, reverse it on the other side. So you got the two opposites here, and twist them until they lock in over the spine, and then just rock the spine, loosening the tissue right over the spine. Okay, so that spinous ligament is something that you're trying to address here. And always be aware, talk to them. I'm always using my fingers as a reference, telling me where I am so I don't grind over a bone somewhere. How you doing there, Wayne? You okay?
Yes.
Okay. Next thing that you want to really address is the internal and external rotators. So again, back into this, staying close to the SI joint, find where that piriformis attaches and comes through, and start arranging it out. Come down here to the trochanter and capture that. So you should get a nice pull in that piriformis. Everything that you feel pulling, when you go in one direction, you go the other direction. So you simply reverse the directions and slightly lift upward. There you go. Go from inferior to superior. And that will loosen your internal and external rotators. The release of the laminar groove is straightforward. Work it, work it, work it. Constantly work it. All the way up to the occiput. Work it from top down and bottom up. See how my fingers grab around the spine, place my hand securely over it, and without stones I can do a very similar thing. My thumb's on one side, the index finger's on the other side. Some people do something like this. They cover their fingers, and that's fine. Some people use a covered thumb. It doesn't matter, so long as you stay close to the edge of the spinous process and clear the tissue. Okay, and that's what you're trying to do here. You're trying to work the ligamental structure primarily in here while this person is floating on this bolster. The other thing we can do, of course, we can get out the vacuum therapy system, and this is a wonderful place to do it. You can look for the congested tissue where you have a lot of wrinkling and where you have dimples, and work this whole area all the way up the spine with that vacuum therapy system, and you'll find that gives you a tremendous amount of results. So this covers pretty much the prone position for this structural work. It's not very complicated, but understand it takes a little time, and just feel the tissue and work through it. Okay, this is the third part of the self-help regimen. The first part we said was to basically put a heating pad under your back, elevate your legs, put some heat into the crease, as I call it, in this area, and then let the psoas release. The second part was to lie face down, keep your head straight, put a pillow under your chest and under your head, and bolster yourself through these two bones. Get your feet elevated up, and every 5 minutes raise your legs and rock your legs back and forth, and do that for about 15 minutes. The third part then is called body arcing, and what it will encompass is some of the same tools we're using. Now, depending on the size person of how much arc you're trying to create. Some people lay this under their back, and that works. And some people, on average, lay this under their back, and this is that heating pad. And what you do is you just roll it up, and it's full of silicone, so it's like a rock. And to make it a little more comfortable, we either put one of these pillows over it, or we put a towel over it. Doesn't matter, just to give it a little bit of padding. Okay? So on Wayne, not being a very large person overall, we're going to make it easy on him. But what I do with these heating pads is I normally put them in to an oversized pillowcase. And the reason is, when you lay it on someone, and it's a little bit too warm, something like that, you can always flip that over on top of it, and that gives it a barrier because the pillowcase is that long. So we're going to roll this one up, and it keeps it in a tighter roll. And the concept is really important to understand where we lay this, so I'll explain it as we go. I'm going to sit up for me right here, nice and easy. Always help them sit up. Tell them, don't lay back until we have this adjusted. We're looking, so many people have this kyphosis. And really, we're not trying to arc the whole back. We're trying to go through the shoulder blades and use the shoulder blades as rockers. So, I'll place this pillow, not this pillow, but this towel here. It'll be a little easier to see. And you want to make sure his head is not in hyperextension, so you put everything in place ahead of time. Lay back until it feels like it's through the shoulder blades, and let your head fall back. And if the head's coming back too far, then just fold the pillow up. Does that feel like it's kind of through the shoulder blades? It should not be in the low back. The next thing is you want to elevate the legs. It's pretty important that you get these legs elevated. So the concept is you do not want any strain in the low back. You want it just through the shoulders. If it doesn't feel like it's tolerable, then you may want to adjust it up just a little bit. But it should come right through, no lower than the bottom of the shoulders. And what that does is expand this anterior plane. Okay? So next thing then we do is, again, we're back to this costal margin. You can't get away from working this area. And we'll go back to working it. And you can take the vacuum system and you can work through it if you want to do that. You can take the stones and you can work through them. But some other things you want to do is consider just a little bit of visceral work. And that is kind of relaxing the colon. So come to the crest, reach slightly in and just knead toward me, basically from the crest down and back. So you're loosening the psoas at the same time you're doing this. The psoas crossing the sigmoid colon on the left side is chronic for constipation. So work from the left side up and underneath the ribs and across and under the liver area and all the way back down into McBurney's point, which is 1/3 the distance from the point of the ACES to the navel, and that's where the appendix is and the ileocecal valve. And normally you work it clockwise as you're facing the person pulling toward you in a clockwise manner, because the small intestine comes around and attaches to the large intestine here. So you're kind of pulling and opening that valve. Okay, and that's a little bit of visceral work. Same thing then. Start using these stones, whatever you want to use, and really start peeling the tissue from lateral to medial. And if you're in a gown, of course, you bring the gown up to right here and tuck it nice and securely. I always tell people, ladies, you can leave your bra on. That's not something you'll need to work around because you're just working at this area. Okay, and then you have a gown on and you're very draped. Okay, you can do that. These little stones are particularly nice for this area because you can take that little chiseled in with your fingers again and really reach up underneath there. You want to do a little bit of diaphragm release. And to release the diaphragm, you come down to the xiphoid process, come back, pick up some tissue, go back up underneath it. Simply pick the tissue up and bring it over your fingers. A lot of people just dig up underneath here. That's not very comfortable. So pick it up over your fingers and allow your fingers to sink nice and slow, following their breathing rate. Are you okay here? Always ask. And hold that for a little while until you feel a nice cardiac pulse. and then release it. Okay, so that's a good diaphragmic release there. So we work this costal margin, we work down into the viscera just a little bit, and then of course you're back to this psoas and pectineus again. We're back to where we were. Reach around, you're going to reach right here and capture again that psoas, that pectineus, the same thing that you did before, and bring this leg into a range of motion while he's being arched. That allows you to actually pull and reach across here. Normally I'd come to the other side for that, but I can do it from right here. And just reach right here and hold the ASIS, my thumb holding down into the psoas. I can feel it when it pops. Often you'll get this popping sensation. Remember that psoas is crossing the hip, and as you're tightening there, you'll feel that popping sensation. Okay? So, from this lower extremity then, start working your way back up. And we're going to work up into the other muscles that are causing some of the restriction, some of which are the latissimus. And so we would tell this person, I would normally be on the other side, but you won't be able to see if I do that. So I'm going to hold here, and he's going to raise his arm just like this, and I'm going to brace into it. And this is not real comfortable for me, and I'll show you how I would normally do this. I would be here, I would brace into it, and he would raise his arm up. There you go. Okay. Same thing then. I'm going to ask him to put his hand right here. Now I would work that serratus down, clamping the tissue and working it down. I would then place my hand under the shelf of the scapula, bring the arm across, and let my fingers sink in. Let your arm relax for me. Let my fingers sink in right here into the scapula, staying next to the rib with the back of my fingers, and just slowly go in there. This can be really uncomfortable. You okay, Wayne? So you can really reach deep into the scapula like this instead of just digging in there and move it around your fingers instead of you moving through the body. And work as far up in there as you need to work. Same thing is for the pectoral minor. Now place this hand behind your head, and you'll see the pectoral minor is going to be accessible right here. So you're going to raise your arm up. I'm going to place my fingers next to the ribs, trying to find one of those slips. I'll reach over here and capture the pectoral and pull it over my fingers again, working back and forth, asking him, now lower your elbow and raise it up and down, just like that. And this will stretch out that pectoral minor by releasing the bound up tissue. Stay close to the ribs and you won't have much problem with dealing with lymphatic problems. Stay right on the ribs and go until you feel the little slips. Remember that it attaches the third, fourth, and fifth rib and up to the coracoid process. So here's a wonderful thing you can do with the vacuum system. You can put it right on this coracoid process right here and draw all the attachments. Remember what you've got going on here is you've got a piece of bicep, coracoid brachialis, and pectoral minor all attaching to that one point. And you can either work it, which is very uncomfortable, or you can put a vacuum on it, and that makes it much easier to release that area. So then we'll have gone through the latissimus, the serratus, the subscapularis, the pectoral minor. So we're back to letting that shoulder go back. Okay, from there, we're going to go up into the shoulder and do a little bit of distraction. Any number of ways you can do that. You can bring this arm towards you, wrap around it, reach up underneath the scapula, and simply bring it with you. And just bring it with you. Don't just pull it across, but pick up underneath it and bring it with you. And this little arm lock that I'm doing is a very powerful way of getting that particular leverage. As you can see, the way to get into it, most people have problems with this. take the back of your hand and the back of his hand and let them fall across, and then turn your hand until you capture. And this is kind of an old martial art arm lock, but you can move any number of ways to get some good distraction out of that scapula. Okay? Not a very hard procedure, but again, I'm doing this much faster than most people would. You okay in this position still? Always ask, because people can get really uncomfortable thinking they're going to have to stay here. So you slide this out in the pillow and maintain control of the head at the whole time. Do not let it go into hyperextension. Holding slightly down across the shoulder, holding at the base of the occiput, and holding the semispinalis in my fingers. Actually, that's what I'm doing here. I'm starting to do a full range of motion. I'm using his head next to my body, and that makes him feel safe, like I'm not just going to flop, drop his head. Switch hands, same thing. Not put it into hyperextension, but constantly control that C1 area. Take your time with that. Next thing I'm going to do is work into that motor cylinder again. Just like we did in a sitting position, we can work this in the lying position. This being the SCM scalene shear. If he turns toward me with your head, and I just drag right across here, then you'll get that same effect and up into the occipitals. I'm going to do a composite movement now on the other side. I'll be doing this. I'll be reaching down and pushing across the trapezius, just pushing that trapezius back. So I can do two movements at once. He turns toward me, I push across this shoulder, down to trapezius, and across the SCM on the other side. And then I have these wonderful warm stones, and I make them just part of my hand just by holding them in here, and a little piece of them is touching him. Mostly I'm using the edges of my thumbs and the thenar and hyperthenar eminences of my hands. And I can go to the other side and do the same thing. I'm staying out of your way to do this. And turn your head to the opposite side. There you go. And back to me. And I can go back underneath the occiput with these, holding them in my hand just like this, and pick up right into the base of the skull, working under that suboccipital ledge. And you'll spend some time doing this, of course. You can then take the fascia from the front and drag it all the way up. Keep the continuity using the back of your hands, and again drag all the way down, pushing everything down. Just keep a continual tension with your arms. Then we do something I call doing the alices, which is I'm going to work the frontalis, temporalis, and the occipitalis all at one time. And the way I'll do that is I'm going to reach up underneath his head and capture on the opposite side from this hand, and I'll show it from this side. And I'll be dragging across here under the occipitalis, through the temporalis, and across the frontalis. And I'll be doing this with two hands as he goes through the motion with me. Okay? You're going to turn your head to the right for me. As he does, I'm just pulling through here. Okay, stay right there. I'll reach underneath here, same thing. Capture here, turn to the left for me, pulling through the occipitalis with my left hand, temporalis with my right hand, across the frontalis, back up and through all the way around. And back to here again, same thing, turn toward me, come across, cervical vertebrae through the temporalis, frontalis, and just work this entire area. And so I'll be working all of these muscles, and I call this doing the alices. Of course, then you can do a nice little loosening up effect here of the entire cranium. And don't ever miss doing this, because you'll get lots of mileage loosening up this fascia in the cranium. At some point I read that the cranial fascia is 4,000 pounds per square inch tension, and most of the body fascia is 2,000 pounds. Don't know. I just repeat things that I read and study. A lot of things are theoretical that are taught as fact, and it's important that you understand that so often what we're told is fact is more theory. And so you're not hearing me say that, oh, this is a fact and that's a fact, because it is hypothetical. I'm going to take this out. This is very important now. When you come off of this position, you normally want to roll into a fetal position. If you're doing this at home by yourself, after you've been laying in this position, you want to roll off into a fetal position, and that will keep any spasm from occurring that might occur because you'll reach up and bend too fast, engaging that psoas muscle. So, saying this again, you would roll into this position and wait in that position for just a few minutes. Okay? I'm going to take this out, and he's going to lay back on his back. Then the last movement that we're going to do is a sacral distraction. And this is a composite movement that allows me to, again, clean that laminar groove and traction all the way down through the sacrum. And the way it works is this. This hand is going to come up, and this hand's going to come out of my way. I'm going to fold his legs and lay them into my hip. I'm going to reach as far as I can underneath here, usually starting at the superior edge of the scapula next to the spine, and start moving the legs. And as the legs move, if I wrap around his body, my arm is being pulled down. I just catch a new spot each time, but I lever against his body with my arm, and what's happening is every time I move him, he physically is pulling me down. So I'm not sitting here ripping my shoulder off trying to pull myself down his back. I'm simply leveraging myself by holding onto his body. But every time he folds, of course, he's pulling me further down. And I don't really have to hold his legs up because they're being supported by my left leg and by my hip. I'll come all the way down one side, and then I'll come down through the spine directly, doing the same thing. And again, I'm not using this hand, my legs are doing this work. And I'll do it to the other side, and you'll be able to see a little bit of this on the other side. And then, of course, we always ask them if you want pictures, double negatives, you can put them on your website. You can impress your friends, take it to work and say, our employees are flexible. Yeah, that always gets real accolades. And we'll bend you like this. Stay flat on your back for me, please. There you go. And again, as you can see, I've slipped right in here. I've reached around, and you already know where this hand is. So use that hand as a counterbalance. Let it just fall out. There you go. Leave this hand up, and then just rock. And just keep rocking. And then he's pulling my hand down, and I'm not really applying any weight. Okay, and then always help your person to sit up by dropping the arm over and have them sit on their side. That's the way you get up. You do not just physically fold and jump up, because often you'll engage that psoas, and that's when your back goes out on you. So this is the structural regimen, musculoskeletal alignment, and hopefully we'll get enough information out of it. Again, you'll do it slower, take your time, follow the principle, not my techniques. The concept is sound. Now when Wayne stands up, we started out initially checking him, and this time I can put my finger here And I realize I have more head back than I had to start with, because I use a mark. Basically, I'm using the muscles of the mark. So overall, his shoulders feel back, his hips should feel fairly square, and he should feel like he's rather open. Is that about what you feel like?
Yes.
And you have to tell people what they feel, because they really don't. I know I feel something, I just don't know what it is. And you'll tell them, feel your hips, close your eyes. You'll realize they feel flat. Your stomach feels flatter because your hip is no longer rotated. And you don't feel like you're having to hold your shoulders up. You actually feel, if you close your eyes on this person, here's a test for him, his feet will normally be pointed out, and if he closes his eyes in just a moment, he'll start falling backwards. And you'll just start feeling that backward sensation there, because your weight has been displaced back. So this is, again, the structural regimen, and I hope that you enjoy it. Thank you.